I'm Stella. Today I'm going to demonstrate how to make the alginate impression and use the impression to pour the model. So before I perform the procedure, I will explain to my patient. Let's say I'm seeing Miss Chan. So I will explain to her like, "Hi Miss Chan, today I'm going to do the impression on you. What I'm going to do is I'm going to use this alginate impression powder material mixed with water, and after the mixing procedure it will feel like a cradle substance. I will put it onto the tray and then I will put it into your mouth, wait for it to set, and then we'll take it out, double check the impression is good, and I will clean up your face, your teeth and everything, and then I will use this impression material to do the oral appliances, whichever the doctor prescribed for you. So after the explanation, I will set up everything and put on full PPE, and I'm ready to go. Now I'm going to demonstrate how to mix the alginate impression. The alginate powder we are going to use is this one. So this is the A side and B side. So what I have to do is I have to make sure all the powder go to the A side. The B side is going to use to measure the water needed to mix the powder. And then I use a scissor to cut along the line. I will lift the powder here. So this is going to measure the water up to the line for the powder. So I will pour the water into the mixing bowl. And next, I'm going to incorporate the alginate impression powder into the mixing bowl, and then I will mix it. So I will incorporate the powder and the water. Now I'm going to mix it. When the color turns pink, I'm ready to load. And then I'll use some water to smooth the face, and then I'm ready to go. I'll sit from the back to the front I will ask the patient lean forward a little bit. Also, I will ask the patient to breathe through the nose. I will use my other hand, clean hand, to stabilize their head or neck, and also my other hand to stabilize the alginate impression. Also, I have to make sure the middle of the tray is lined with the middle of the front teeth. Also, I have to kind of lift a little bit to massage it so the impression material will sit better. So I will wait for the material to become rubbery, it's hard, and then I will take it out. It's almost done. Okay, now it's hardened. So I will break the seal. And then I will double check the impression material is good. And then I will rinse under the sink, over the sink with water. And then I will spray with disinfectant. If I'm not going to pour the model right away, I will use this wet paper towel to wrap around it and put it into the Ziploc bag. So next I'm going to clean for the patient. So I have to use the floss to clean between teeth because some material might stick between teeth. Also, I'll give some mouth rinse or water for the patient to rinse because this might have some bad taste. And also I will give some wet paper towel to wipe the face so they will walk out of the office clean and nice. And then I'm done with the alginate mixing part. Now I'm going to demonstrate how to pour the impression model. Now I have the pre-measured powder, stone powder, and pre-measured water, 35 ml. What I'm going to do is I'm going to pour the water into the mixing bowl and incorporate with all the powder. Mix it, and then I will put it into the tray. But before I do this, I have to pick out the impression. Rinse under the sink to make sure all those disinfectant, all those materials are clean. And then I will use air dry to make sure there's no water or it's dry, or maybe use some paper towel to gently tap around the impression to make sure there's no water inside, because if there's water it will make impression maybe some void, some bubble. So after I prepare this, I can go ahead to make the water and powder to make the model. So now I have already dried and make sure the impression is clean and dry already. Now I'm going to mix the stone material. I will pour the water into the mixing bowl. I'll incorporate all the measured powder into the water. Okay, so now I'm ready to load. So now I'm going to pour the model. Make sure the model, the stone material, cover all those anatomic area of the teeth. And then I can put all the rest of the material onto the impression. Since we are going to do the bleaching tray, the base can be thin, so we don't need to put that much material for the base. So the rest of the material, I would just dump into the garbage. I would never put it into the sink because it will clog. So I will wait for this stone material to set, and then when it's set, around like within an hour, I will take it out and then double check the impression stone material is good, no void, and then I'm good. Now the models is already set, so I'm going to take off the model from the impression. Okay, and now I'm going to double check if there's any void. Okay, looks good. Looks good to me. Okay.